How's it going, guys? Medium difficulty question for Gastro Step 1. Pass level question for internal medicine. TCK, 38-year-old woman. She has 6-month history, generalized pruritus. Physical exam shows mild scleral icterus. Laboratory studies show elevated direct bilirubin alkaline phosphatase. Brother has RA. Question wants to know what's most likely to be seen in this patient. Now, we have a very buzzy, easy diagnosis here, okay, as I'll talk about. But we're asking you maybe something a bit more involved, increase the difficulty. Choice A, anti-microsomal antibodies, wrong fucking answer. That refers to Hashimoto, okay, which clearly we don't have here. So Hashimoto, hypothyroidism, autoimmune, can have anti-microsomal, aka anti-thyroperoxidase, can also have anti-thyroglobulin. So not just high TSH, low T3, T4, primary hypothyroidism, but you can have menstrual irregularities. They like that. You can have dysthymia, so low mood, increased CK, hypothyroid myopathy. They can give you bradycardia. They'll throw that into vignettes, heart rate of 60, heart rate of 55. They'll throw transaminitis into the vignette. They can say AST. It could be ALT or AST, but I've seen AST elevation in one vignette. You're like, what the fuck? Why is the AST high? You can see that in thyroid derangement. Wrong fucking answer. Choice B, anti-smooth muscle antibodies, wrong fucking answer, refers to autoimmune hepatitis. So it's a diagnosis of exclusion, meaning you eliminate to get there. Okay, they might give you a youngish patient, 20s to 40s, can often be female. And after eliminating the diagnosis, other diagnoses, you'll see that ALT, AST are significantly elevated, and you're just left with autoimmune hepatitis as the answer. As far as differentials, what I'm referring to, the extended differential as far as choledocholithiasis, head of pancreas cancer, etc., bile duct leak. Okay, I've made tons of clips on these DDX. Wrong fucking answer. Choice C, hypercholesterolemia, correct answer. So medium difficulty answer, pass level diagnosis for primary biliary cirrhosis, going to be a woman 20s to 50s who, this is as textbook as it gets. Okay, they'll say generalized pruritus, high cholesterol, high ALP, high direct bilirubin, and they'll throw in that there's an autoimmune disease history in her or a family member. They can say she has history of autoimmune thyroiditis. She has history of vitiligo. Her brother has rheumatoid arthritis. Okay, so this is the combination you need to know. This vignette, as simple as it gets, plus high cholesterol. I mean, this is primary biliary cirrhosis. And you get anti-mitochondrial antibodies, OMG, not anti-microsomal, okay? And you can give ursodeoxycholic acid, aka ursodiol, as a treatment, which decreases cholesterol secretion into bile. Let's just hop to the others real quick. Hypoalbuminemia, wrong fucking answer. Some students are going to get emotional right now as far as why can't this be right? I mean, if you have cirrhosis, right, and the liver can't make albumin, you'd say, well, isn't that a high yield cause of low intravascular oncotic pressure, for instance, right? It's true, but you have to think about best answers. Okay, so it's much more likely a patient's going to have hypercholesterolemia before she reaches the clinical threshold of hypoalbuminemia where she's got edema, ascites. So it's not a bad answer. It's possible, but hypercholesterolemia, much more buzzy, much more textbook. Choice D, wrong fucking answer. Choice C, prothrombin time elevation, wrong fucking answer. So similar to choice D. And by the way, this is how you can probably eliminate both of them, is that they're the same in that you see them in advanced stages of cirrhosis. So you can't say one is better than the other for D or E. That's how they're both wrong. So it's a high yield factoid. You're aware that elevated PT is one of the ways USMLE likes to assess advanced liver disease. Okay, so if you're forced to choose between which variable is more specific for advanced liver disease, it would be an increased prothrombin time because the liver is involved in synthesizing clotting factors, as opposed to transaminitis. Cirrhosis, you can have normal liver enzymes since you have burnout of the organ. Wrong fucking answer. You know the deal. Once you make more content like my subscribe channel. Appreciate your time. That's it.